Hello, everyone. I'd like to thank you for joining us for this month's webinar, which is on heart health. Our presenter this month is Robin Glock. She's an RN and a health coach with Strategic Health Services. Robin? Hi, good morning, everyone. As Dawn said, my name's Robin. I'll be presenting the February webinar, which is Heart Health. February is American Heart Month. So heart disease is the leading cause of death for both men and women. The CDC reports that 610,000 people die of heart disease annually in the United States. So that's basically 1 in every 4 deaths. So we're going to think about what is important to you in regards to heart health and move forward on the road to prevention. So below are some of the objectives for the Heart Health webinar, and the goal is to educate and bring awareness to a woman's risk of heart disease, do a basic overview of heart disease, identify risk factors, some ways to keep your heart healthy and reduce those risk factors, some vital screening tests and what those numbers mean to you, and the importance of having a good rapport with your physician. So whether you're running a marathon or preventing heart disease, every journey begins with one step. Let's take a closer look at women and heart disease. So the Heart Truth is a national campaign sponsored by the National Heart, Lung, and Blood Institute. Heart disease is the #1 killer of women and more deadly than all forms of cancer. So with the Heart Truth, it's a campaign and it does have a large group of supporters that are trying to empower women to live for their hearts. It's designed especially for women ages 40 to 60, which is when the risk of heart disease starts to rise, but it also has a good message and is important for younger women as well, since heart disease does develop gradually and can start at a young age. So the program also wants women to know that even those who have heart disease can improve their heart health and quality of life. So the overall campaign goal is to raise awareness of heart disease, the risk factors among women, educate and motivate them to take action to prevent the disease. The red dress pin is the campaign's national symbol for women and heart disease awareness. So you may see, if you've never seen that before, that would be the national symbol that they're using. And you can also go onto the American Heart Association's website and you could purchase the pin and find out more about the campaign. So let's take a look at what is heart disease. So cardiovascular disease, also called heart disease, can include a number of different heart problems, and many are related to a process called atherosclerosis. Atherosclerosis is a condition that develops when a substance called plaque builds up in the walls of the arteries. The buildup narrows the arteries, making it harder for the blood to flow. And if a clot forms, it can stop the blood flow. This can cause a heart attack or a stroke. Risk factors are conditions or habits that make a person more likely to develop a disease or to see an existing disease get worse. Important risk factors for heart disease that you should be aware of is having high blood cholesterol, being a smoker, being overweight, having high blood pressure or diabetes, being physically inactive, having a family history of heart disease, and age. 65 or older, you do have a higher incidence of death from heart disease. So let's explore some ways that you can reduce your risk. One would be stop smoking, become more active, lose weight or maintain a healthy weight, eat better, know and improve your cholesterol levels, know what your blood sugar level is, and manage your blood pressure. On the next few slides, I'm actually going to go into more detail on each of those risk factors that you can control, starting with smoking cessation. So smoking is a major risk factor for heart disease for men and women. Quitting reduces the risk of coronary heart disease, stroke, and peripheral vascular disease. And your risk of heart disease and heart attack increases with the number of cigarettes that you smoke. So people who smoke have a 2 to 4 times higher chance of having heart disease. Cigarette smoking causes 1 in every 5 deaths in the United States, and it is the main preventable cause of death and illness. The nicotine present in smoke can affect your heart by decreasing the oxygen to your heart. it's increasing your heart rate and blood pressure, and it's damaging to cells that line the coronary arteries and other blood vessels. So when you think about stopping smoking or tobacco cessation, you have to overcome your addiction to the tobacco and learn some new responses to situations and activities that trigger you to smoke. So tracking the amount you smoke each day, recording comments as to why you're smoking will help you identify what your smoking triggers are. Then you can start to put a plan in place to overcome the urge to smoke. So if you're thinking about quitting or if you're ready to quit and would like more information, please contact your health coach. We do have information available to you on the My Pathway to Health website, and we also have a smoking cessation program. So the next slide, we're going to talk about being physically active. So it's important to be more active. Daily physical activity increases the length and quality of life, but also can reduce your risk of heart disease. The American Heart Association recommends 30 minutes a day, 5 times a week of moderate exercise. They're now saying you'll also experience benefits if you divide that time into 2 or 3 segments of 10 to 15 minutes a day. So one of the simplest changes that you can make for heart health is to start walking. Every step counts. So try parking farther away from your destination, whether you're at the store or at work. Take some short walks throughout the day, 10-minute chunks of time. Try to break it up and get more steps in. Use the stairs instead of an elevator. Or just take your dog for a walk around the neighborhood. Try to make it a healthy habit and find the time to take care of yourself. There's also an exercise tracker where you can log your activity on the portal, and it's something that you can share with your health coach, and that helps us keep follow along with your progress and see how you're doing with your activity. Maintaining a healthy weight is a controllable risk factor for heart disease. If you're overweight or obese, you're at a higher risk for developing chronic conditions like heart disease, high blood pressure, and diabetes. So the term BMI, or body mass index, is the number calculated from a person's weight and height. It's a screening tool used by the medical profession, and it evaluates possible weight problems. It's not a diagnostic tool. To determine if excess weight is a health risk, a healthcare provider would need to perform further assessments. So you would need to have an evaluation of your diet, your physical activity level, your family history, and other appropriate health screenings. So if it is determined that weight is a risk factor, keep in mind that losing 5 to 10% of your total body weight can have a positive impact on your health and overall wellness. This slide is a breakdown of the BMI standards. It shows you what the BMI number means in relation to the weight status that it represents. You can log into the My Pathway to Health portal and find this information in your personal health profile, or you can go into the calculators and you can calculate your BMI using that tool. So to decrease your risk of heart disease, you need to maintain a healthy diet or lose weight if you're overweight. So if you'd like to lose weight, it's important to view the healthy changes as a new way of life and not a diet, because fad diets are temporary and they can lead to weight gain once you change that style of eating. So some things to consider is the key to successful weight loss is burning more calories than you consume. The challenge is often more mental, and getting in the right mindset is often that first, where that first change begins. Take a look at your diet. Start off slow, maybe one day at a time or one meal at a time. Focus on getting in more water each day. Sometimes your hunger cues are actually thirst. Plan ahead. Pack a healthy lunch and snacks for work. That'll help you stay on track and not be tempted to eat at restaurants or vary from what you'd like to be eating each day. Try to increase your fiber intake to help you stay fuller longer, and watch your portion sizes. Consider using smaller plates or bowls at mealtime. This slide just goes over some heart-healthy eating habits and some things to consider. So, when you're looking at meat, try to pick out lean cuts of meat, trimming away the fat, taking the skin off of poultry. If you're getting ground beef, going for the 97% or leaner, and also, the chicken and turkey. Focus on fruits and vegetables. A diet that's rich in fruits and vegetables should be focusing on a rainbow of colors, trying to get a variety of different colors for good vitamins and antioxidants. Looking at whole grains, which are higher in fiber. So a lot of products are marked now. They want you to buy their products. They want you to say, hey, look, that's whole grain. And you can vary and change up your cereals, your pasta, your rice, and then even, your breads and crackers and things. Reduce added sugars. So think about minimizing and reducing beverages or foods that have added sugar, that have, cakes, cookies, candies, soda, those types of things. Little or no salt. So when you're cooking, put away the salt shaker. Try to add in a variety of different spices, even Mrs. Dash, something that keeps that salt content down. If you are using alcohol, do so in moderation. According to dietary guidelines, that's 1 drink per day for women and up to 2 per day for men. If you're looking at dairy, whether that's your cheese, milk, yogurt, focus on the fat-free, skim, or low-fat. And then oily fish. Eat fish twice a week, especially the oily version, which is higher in the omega-3s, and that's going to be salmon, tuna, and those are shown to have the higher omega-3s are considered essential fatty acids, and they are proven to show for better heart health. Now let's take a closer look at your cholesterol number. It is broken down into 4 different components. The total number is the cholesterol, which is a waxy fat-like substance. It's found in all cells of the body. Your risk for heart disease rises when there's too much cholesterol in your blood. It builds up in the walls of your arteries, increases your risk of developing heart disease. You can lower your cholesterol and your risk by managing that level. So that number is affected by whether you're a tobacco user, what you're taking in dietary-wise, your activity level, your weight. And remember, these are controllable risk factors, things that you have control over. You do have a cholesterol tracker available if you'd like to enter in your cholesterol numbers. That's available on the portal. And it's something that you'll find not only in your health profile, but if you do have it repeated throughout the year, it's something that you can add into a tracker and you can see how your numbers are running. The next component of a lipid panel is the HDL, and this is called the good cholesterol. A high HDL is protective against heart disease, and it protects the linings of the arteries from developing plaque. The optimal level to reduce your risk for heart disease is they want you to be greater than 40 for men and greater than 50 for women. Some ways that you can raise your HDL level is maintaining a healthy weight or losing weight if you're overweight. Avoid cigarette smoking, increasing your physical activity, and there are people who are very active that would still like to see a better number for that HDL, and sometimes it's just about varying up what you're doing. So if you're always doing the same exercise, adding different muscle groups, different activities in can be helpful. And then avoiding foods that are high in trans fats, and so that's your red meats, your poultry skin, your full-fat dairy, fried foods, donuts, and focusing more on some of the better fats, which is found in olive oil, nuts, natural nut butters, avocados, those types of things. Another part of the lipid panel is the LDL. It's the bad cholesterol. If there's too much LDL in the blood, it can lead to plaque formations and increase your risk of heart disease and stroke. The optimal level is less than 100, but a level of 130 or less is considered normal. Some ways that you can reduce that LDL is reducing foods that are high in saturated fat that we just talked about. Also getting plenty of exercise, eating plenty of fiber, making some dietary changes that include a variety of plants, fish, whole grains, and fruits, and then focusing on taking your medications if prescribed, which would be statin drugs. One place that you can find some of this information is on a food label. So reading food labels is a very important part of staying on track and knowing what your numbers are. And the final thing that they check for the lipid panel is your triglycerides. It's that fat in the blood, and it is used to provide energy to the body. The triglycerides are derived from fat eaten in food or made by other energy sources like carbohydrates. So those calories that you're taking in at each meal and not being immediately used are converted to triglycerides and transported to the fat cells to be stored. So the optimal level to reduce your risk for heart disease is they want to see a less than 150. Some ways that you can lower your triglyceride levels is to lose weight, cut back on calories, avoid sugar and refined foods, cakes, cookies, candies, limit the cholesterol in your diet, going back to the food labels, eliminating the trans fats, limit alcohol, get some regular exercise, and take medications that are specifically prescribed for high triglycerides if they are ordered by your physician. Now we're going to move on and think about some important blood tests that you should be looking at, and blood sugar is one of them. Keeping your blood sugar in a normal range will have a positive impact on your heart health. So you want to focus on healthy eating and exercise to keep that blood sugar on track. And the American Diabetic Association is recommending that all adults age 45 or older be considered for a diabetes screening test by their healthcare provider every 3 years. So if you have pre-diabetes, you should be checked every 1 to 2 years, depending on your doctor's preference. And if you are diagnosed with diabetes, it's important to follow up with your doctor for repeat blood work twice a year or more often based on your doctor's advice. The goal here is to help maintain a good blood sugar level. Now let's take a look at your blood pressure. It's important to know your blood pressure and take action to maintain a good reading or improve any elevations that you do have. It can damage your heart if you have high blood pressure. It also can cause some problems with your blood vessels, kidneys, and other parts of the body. So there is some things to take into consideration when you're having your blood pressure checked. Stress can play a role in that, caffeine, smoking. There are different things that can affect the number. So if you're trying to, take a look at what your normals are, we recommend that you're checking it at least twice on 2 different occasions. But this table represents what a normal blood pressure is if you don't have any risk factors such as diabetes or a history of high blood pressure. Less than 120/80 is what we're looking for. And then you see it breaks down into prehypertension, and then the high blood pressure is broken into stage 1 and stage 2. So when you're thinking about blood pressure control, there's some lifestyle changes that can help lower blood pressure naturally and help reduce your risk of heart disease. Number 1 being stop smoking and eliminate tobacco products. Also reducing the amount of sodium that you're taking in every day. So read your food labels, keep your salt intake to no more than 2,300 milligrams per day. Exercise, getting more active, lose weight if you are overweight, managing your stress, reducing or eliminating alcohol intake, watching your caffeine intake, and then take your blood pressure medication as prescribed by your doctor. We do have a blood pressure tracker available on the My Pathway to Health portal. That's a nice way to keep track of your blood pressures, and it's also a good way for your health coach to follow along as well. So here are some key screening tests recommended for optimal heart health, and most of these we've talked about in detail already. But the screening tests that you should be looking at are, what is my blood pressure? Getting a cholesterol panel that has the total cholesterol, HDL, LDL, triglycerides, knowing your BMI, your waist circumference, a fasting blood glucose, and if recommended by your physician, a baseline stress test, an electrocardiogram, or EKG. It's important to have a good rapport with your doctor. It's a crucial step in determining your risk and to see if your doctor for a thorough checkup. Your doctor is an important partner in helping you set and reach goals for heart health. And if you know what your cholesterol levels are, your BMI, blood pressure, blood sugar numbers, you have better control of your health and your risk for heart disease. So working with your doctor, develop a plan to keep your heart healthy and keep those numbers under control. When you see your doctor, be open and honest so they have a clear picture of your current health and risk factors. And ask questions. Make sure you understand what the doctor's saying to you about your health and wellness. If you have questions, write them down. Take the list in with you. Once you get into the office, sometimes it can get a little overwhelming. So if you've written down your questions, you can write down the answers. You'll have more information when you leave the appointment. So the month of February is Heart Disease Awareness Month. Be sure to wear your ribbon of red in the month of February to show support for this campaign. And just let this month be a reminder to update your health coach on your heart health. So as always, remember the My Pathway to Health website does offer many different education materials in the health library as well as interactive tools. So contact your health coach today and get ready to manage your heart health on a daily basis. Thanks for joining the webinar. This concludes my presentation.